Heather Abraham had her new baby Rocco at West Penn Hospital last week. Fortunately, he was healthy and strong, we are so happy to say, but that's not always the case for some new babies.
Yeah, it's not. And in today's Eye on Health, we're talking about a wonderful new resource that's in Pittsburgh for babies who arrive prematurely and need help surviving and thriving.
Yeah, it's West Penn Hospital's Neo-Natal Intensive Care Unit, or NIC-U. Mikey Hood got a chance to visit and see firsthand the difference that it is making in the lives of the tiniest patients and their families.
The West Penn Hospital Neonatal Intensive Care Unit is brand new just this year, and they are taking a special approach to the way women and their babies are cared for.
We are very focused on family-centered care, that the parents are not visitors, they're an active part of our team, and therefore we wanted to have a facility where they could be comfortable and that they could also interact on a regular basis with their babies.
What sets the intensive care unit apart from other facilities is their focus on the entire family.
Having single-family rooms is really the state-of-the-art, the NICU, and that having capacity for the parents to be able to stay in the room is relatively different.
The rooms and the common space uses an organic theme with lots of natural light, which is good for the mood of the mother and the staff as well. And women with twins get special rooms too.
The parents can obviously be in the room together with both of their babies, and then lots of people believe in the twin healing power of being together, and so we do want to make sure that they're together.
The patient's family ends up being involved in the entire process. The overall experience is meant for the entire family, but when the parent is alone at times, there's a place to go.
And we also have facilities out in the lounge area where they can interact with other parents because they often feel very isolated being in the room by themselves.
Latrice Taylor is a patient here in the NICU. After giving birth last week to a little baby boy with a full head of hair, she's pretty tired, but says she likes it here.
It's been a good experience. The nurses are all nice. You know, when they need something, they come running to them or whatever. So it's comfortable. Nice rocking chair, nice pull-out couch to sleep in.
There is also technology that can help when the family can't be there.
And so these are our NICU webcams, so when we have parents that do have to travel long distance or parents that are not able to visit or a family that's far away, it's a live stream and they can log on anytime and watch their babies.
There is a true need for a facility just like this.
The rate of prematurity is still high, and that we have about 10% of babies born do need to come to the NICU. So we have almost 4,000 deliveries here at West Penn.
They had more equipment and everything that I would need, so I knew when my water broke just to come here because they would have the NICU and anything in case I needed it.
They have a special transport team for patients like Latrice whose baby needs help fast.
Nurse as well as a respiratory therapist and either a physician or a nurse practitioner that will go out with the team for the critically ill babies by either ground or air to go to the surrounding areas to pick up babies to bring them to us.
West Penn also uses the Volt communication system, which syncs to the nurses' and doctors' mobile phones so that if there are any changes to the baby's condition,
we can instantly be notified of any changes for the baby and respond.
Dr. Krimmel says the work is rewarding.
The babies are so resilient and so strong and can recover from so much, and they're just a very special population.
This is Mikey Hood reporting from the West Penn Hospital NICU.
All right, thanks so much, Mike. He's so cute.
Yeah.
I love all his hair.
Yes, he had a good head of hair, yeah.
And if you want to learn more about the NICU care at West Penn Hospital, go to PittsburghTodayLive.com. We have a link posted for you there.
And keep watching for our Eye on Health series here on PTL. It's every other Wednesday, sponsored by Highmark Blue Cross Blue Shield, together with Allegheny Health Network for your health.